Thank you very much, Rick. That's an overly generous introduction. Don't blame him when I finish mine for that. He's a kind, enthusiastic friend. But I do want to congratulate Rick and the Public Policy Institute. This has been, I agree, an extraordinary program, and hats off to you. Hats off to President Cost and to the students. You should be proud of your institution. I know that I am. Rick asked me to do really two things today, and I'll try my best to do that. First is to provide a business perspective on this really incredible depth of information that we've all shared and learned today, and I'll try to do that. And lastly, to kind of conclude with sort of a homily or a thought about what we do from this point forward, what we do on a go-forward basis. From a business perspective, I'll break that into three categories. One is sort of an overall business perspective on healthcare and what it means. Second, drill down a little bit to a Florida-specific observation. And lastly, even a little more closely defined around this important debate about Medicaid expansion. And I say usually the so-called Medicaid expansion. I think there's a different and better way to characterize all that. And I'll conclude then with some thoughts about what we should do as a community, as a nation, going forward. And to give you a little teaser of that, I'll point out I'm not a doctor or a healthcare expert. I'm just a business person trying to make ends meet for our business. But I would observe that all important innovations and changes occurred in a state of disruption. Either it took advantage of existing disruption or created disruption itself, and I think this is no different. So have that in mind as I move to the conclusion. And I'll be quick on these comments respecting the calendar and the time that we have. Overall, from the overall business perspective about healthcare, it is a profoundly broken system. And I won't bore you or repeat all that you've heard today, but you couldn't have sat here today and concluded otherwise. So we have a system that is consuming 17 to 18% of GDP of a rich nation. It's getting mediocre outcomes for that. Cost growth is unsustainably high. There is nothing that has grown faster over a longer period of time than cost for healthcare. There is no end in sight. None of the speakers today predicted that would change. There's little accountability. There is not a focus on outcomes. One of the few things that I can think of in business where the focus is on what you do instead of what you achieve, and that's been true for a very long time. Measured in any way that I can think of, healthcare as it's delivered, is a broken system, dramatically in need of reform. It's reached a tipping point, I would say more accurately, a breaking point from a business perspective. We simply can't sustain this path forward, and I think that has been the common view of the speakers you've heard today. From a Florida perspective, the picture isn't any different. It's just perhaps more acute in some respects. Speaker Weatherford made an important point about the spend on Medicaid. It is a systemic risk to the state budget, $21 to $23 billion a year. The state budget in total is about $74–75 billion in all. Much of that's pass-through money, as is Medicaid, but it is growing very rapidly and is squeezing out everything else the state does. The speaker was precisely correct about that point. Second, I would end on the healthcare providers, the second panel, which I thought was exceptional, didn't say this, but I would observe that the state is somewhat hostile to healthcare providers. It is overregulated, it is improperly regulated, and it doesn't have some legal protections for physicians or for the healthcare system itself that make it a comparatively less attractive place for practitioners in the healthcare system itself. We have an unusually large number of people in the state without access, without health care coverage. 3.9 million people, about 20%, 21% of the entire state population. That's unusually high, and it's unsustainably high. And it matters to everybody, not just to those 3.9 million people, big as that number is. It affects every single person, every single business in Florida, so it matters to everybody. Affordable care or access to affordable care, I think, is becoming a competitive issue for the state. You can't grow a business, you can't succeed unless you can be an attractive place for employees, and part of that is being able to confidently and competently provide access, affordable access to quality health care, and we struggle doing that in Florida, and the trend line isn't positive. Third, in terms of just a business assessment about Medicaid expansion, and I always say so-called because I think it's just the wrong title, but we'll stay with that for the moment so you know what we're talking about. You could not design a system more poorly designed to produce results than what we have done with uncompensated care in Florida. We do have, and one of the problems I have with the debate is we talk about Medicaid expansion as if it is going from nothing to something, and that isn't the case. We already have a system of universal health care. It's called emergency rooms. It's called safety net hospitals. But since the 80s, everybody here and everybody who's not here has access to health care. It may not be the best health care. It may not be the most efficiently provided. It may not be designed very well for that, but you do have access to health care, and it gets paid for. So it's not a matter of the Medicaid expansion or any kind of expansion of coverage. It isn't a matter of creating something new. It's a matter of doing it in a different way. It's just a different point. The cost will be there, and it's a matter of where you extract the cost out of the economic system. The estimates that I've seen are that in Florida, that the uncompensated health care is effectively a hidden tax of about $1,000 per family. Round numbers, and I think that's pretty valid. The hospitals have no choice but to redistribute costs, take the costs that they are uncompensated for and spread them those that can compensate it, raising their costs. And it's completely understandable that it's done, but it's also completely inefficient, and it does create a hidden tax of about $1,000 per family. Our little business here it's not a large, but we have about 1,000 families, so the math is simple, about $1 million a year. That's $1 million not spent on innovation. It's $1 million not spent on capital investment. It's $1 million not spent growing employment in the state. It's $1 million that is spent on an inefficient way to deliver health care with questionable outcomes. It's just not a very good system. The safety net hospitals, and I listened to Russ Halverson talk, and he was unusually and calm about what he described, but I look at those charts. Remember, the up bars are good, the down bars are bad, and it was a great way to put. Those down bars went down a long ways, and he's given me the benefit of a closer look at the financial statements, and I would not be sleeping at night. He's a more serene person than I am, I guess, but it is, and his hospitals, we're in a state of in extremis. We are threatening to fail these hospitals. They won't go away because people like Russ Armour said won't allow that, but they will not be able to maintain. Remember the 4 or 5-star ratings? They won't be able to maintain that long-term absent some change, and they perform a function that cannot be absorbed elsewhere in the system. It's a crucial function, it's an indispensable function, and it's one that we aren't paying for currently, we aren't supporting appropriately, and we are imposing costs on a system and threatening the underpinnings of that system in doing that. So how do we get here? How do we get to a point where we have 3.9 million people in one state that don't have health care coverage? When did we lose our compassion? When did we all of a sudden decide that we would put up with and acquiesce to a system that had inefficient outcomes, poor results, and disenfranchised so many people in this state, in a country that is the greatest country and the most powerful economic engine in the history of the world? When did we decide all that? I don't think we did. I think we've gotten to this point through a myriad of policies and systems have grown up, and we haven't paid attention to it, and it's metastasized into its current state. But I'll submit to you, it's a fixable problem. It's a fixable system. I'd said from a business perspective, and business isn't monolithic. It doesn't think one thing. Business people are as variegated in their opinions as anybody is. But I think what I am saying to you is representative of a business perspective. Is it's so broken it cannot be countenanced any further. The time is for change. The question is what do you do about it? And I'll offer a few thoughts. First, we have to reframe the issue. There's an old business saying that an early boss told me once, is you can't get the right answer if you start with the wrong question. And that sounds a little felicitous, but it's true. If you ask the wrong question, you won't get the right answer. The wrong question, I submit, is should we expand Medicaid? I'm focusing on only one part, but I'll enlarge this in a moment. Wrong question. The right question is, how do we reform in a way that we deliver health care in Florida that improves outcomes, pays for indigent care, and does so in a fiscally responsible way? That's a better question, and it leads you to a better answer. When business people think about problems, I think we look at it through a different lens than public policy experts or certainly politicians. Not necessarily a better way, just a different way. And I would characterize it as a bit more pragmatic and a lot less ideological. It's just the way that business people tend to think. And the analysis usually starts with an inventory of assets. What do you have by way of assets that can be deployed and arrayed against whatever the issue might be? In this case, Florida's assets are formidable. They start with a fiscally strong state. This state has a very strong balance sheet. It has a relatively low tax structure, so we have capacity. We have reduced debt through recession, reduced debt by over $4 billion, quite a remarkable accomplishment, and we have a sterling credit rating, better than, in relative terms, better than the United States does. And that's been a product of sound, careful, prudent fiscal management by political leaders, and we had two of them here today, and they deserve all the credit in the world for steering the state in a fiscally prudent way to a point where Florida has a strong fiscal posture right now. Second, we have a large and diverse population, 18.5 million people in Florida. We can apply scale to almost anything. Third, Florida is an important state. It's important by virtue of its size. It's the fourth largest state, soon to be, within a handful of years, the third largest state. It'll surpass New York before very much longer. And it's strong from an electoral standpoint. And I'm not a politician, and I disclaim any particular insights into that, but I think it's beyond obvious that Florida matters in a political sense because of its size and because of its relative, just the way it configures itself into national politics. Third asset is we have a very strong private sector healthcare system. You saw the second panel, and you cannot, if you're like me, you cannot help but be impressed by the capabilities and the skills and the attributes of that system, and that's representative of the larger Florida. Florida has a very strong healthcare sector, and it's an asset that can be deployed. Despite my earlier comments and pejoratives about politicians in general, we have strong and principled civic and public leadership in Florida. The Speaker and of the House and Senate President were here earlier. You saw them. They're principled, strong people. I've known both for a long time. Four people that you know of but may not have thought of is the cabinet for Florida. We start headed by the governor. But Florida has, for the public policy students here, is an unusual system. The cabinet matters, and it has a strong executive authority, and they operate really as a group. And if you brought those four people here, Governor Scott, Attorney General Pam Bondi, Chief Financial Officer Jeff Atwater, and Secretary of Agriculture Adam Putnam, and put them with the two legislative leaders, I would put that group up against any other group in any other state. Haskell operates all over the country in about 43 states, and we are blessed with unusually capable public leadership, and that matters in this context. Lastly, this will betray, I guess, my sentiments on this. We have $51 billion of accessible federal funds to apply to an issue, and you've heard the issues about that, and can you trust the federal government to live up to its word and all those sorts of things. You can make those objections, but by law and by policy, there's $51 billion over 10 years that can be applied to the problem. So what should we do? What we need is not specifically an expansion of an existing program that has all the flaws and infirmities that people have talked about in Medicaid, but rather we need to think about this as what we need is really nothing less than a complete reinvention of how we deliver health care in Florida. Several keys to what I think that should be. First, there should be broad coverage. We cannot sustain a system that has 3.9 million people without some form of insurance coverage. And these debates about whether you're really poor or really, really poor, bother me greatly. We cannot have a system that works without achieving scale and having affordable coverage in some form for those people. We have to have, I think one of the hospital CEOs called it meaningful coverage expansion. I'd say really meaningful coverage expansion. Think about 1 million people or more. We need to take a significant dent out of this 3.9 million people without coverage. Second, we need market-driven solutions. I have, as any business person has, significant, almost unlimited faith in the power and imagination of a free market system. You heard the CEO of Blue Cross Blue Shield of Florida, Florida Blue, now Guidewell Health, and just as a disclosure, I serve on the board of Florida Blue. We had a board meeting yesterday. The innovations that are happening by the minute there are beyond anything that I've seen in healthcare in a decade. It's completely reshaping the business into a different model. Focus on healthcare solutions as opposed to just providing traditional insurance in a traditional way with traditional results. And that's just one example. You heard Dr. Rupp from Mayo on some of the incredible innovations that are going on there. There is a free market. There is imagination in that market. There are solutions that can be harnessed, as opposed to, and in contrast to, simply tagging on to a system that is burdened by inefficiency, that being Medicaid. Coverage expansion, but do so with market-driven approaches.